Hi, this is a 5-minute OET video. The topic is greeting a patient. This means saying hello and making the patient feel welcome and comfortable. You might say, why do a video about this? It's easy. Well, no. I've worked with dozens of OET students, and I can say that some of those students found it difficult at the start of their studies to begin a conversation. Therefore, in this short video, I want to show you some very simple language that you can use to get a conversation started in a positive way. First, let me draw your attention to the title of this page, Greeting a Patient You Don't Know. This is important because in some OET role plays, the task tells you that you already know the patient or carer. It's quite easy to greet a patient you already know, and I'll tell you about that at the end of this video. I also want to point out that the language I'm going to suggest to you probably isn't going to work in every role play, but it'll be useful for most situations. What's more, all the information is going to be easy to remember. Here's the first part. Say hello, give your name. At this point, some people like to say, for example, I'm one of the nurses looking after you today. That's fine, but it's not going to work all the time. For example, you could be a general practice doctor, and it would be quite strange if you said, hello, I'm Dr. Johnson, I'm one of the doctors looking after you. Well, yes, it's clear already what your job is. After you give your name, a simple question. Now then, the patient gives their name, John Middleton, for example. And now here is a question you can ask which will sound professional and friendly at the same time. How do you like to be called? Notice it's how do you like to be called. So the person you're speaking to could say, you can call me John, or please call me Mr. Middleton. After that, you want to find out what you can do for the patient. So here's a couple of suggestions. You could say, for example, what's brought you here today? Sometimes we already know what's basically wrong with the patient. The task tells us some information. So here's another suggestion. You could say, I understand you want to talk to me about. And then the patient can give you more information. And that's it, really. Some very basic phrases and questions you can use to start your conversation in a good way. And what if you already know the patient? Okay, that's quite simple. All you have to do is say something like, hello, it's good to see you again. What's brought you here today? Or, it's good to see you again. I understand you want to talk to me today about blah blah blah. So yeah, quite easy. I hope you enjoyed watching this video, and I hope it was useful for you. This video was part of the 5-minute exam English channel. I invite you to subscribe, and I hope to see you soon. Bye for now.